I'm Amber. I'm your gross motor guide for NewDay Child Coaching, and we're so excited to convert our very first Facebook Live event over here to YouTube so that our YouTube viewers can view it. And today in our live deep dive discussion, we're going to be covering the differences between pediatric PT, pediatric OT, and pediatric speech therapy. We're going to talk all about how these three disciplines are different, where we overlap a little bit, and most importantly, how we can all work together to facilitate the development of the children that we are able to reach and able to work with. So we hope you enjoy this video. And before we get started, if you want to hit that subscribe button, we would appreciate it.
For those of you who don't know us, I'm Rachel Lynn.
Yep. And I'm Amber. I'm the one who is struggling to join here.
Aww. Amber is our master of physical therapy, and I am a expert in communication and feeding and swallowing. And we are all things pediatrics, and our specialty is in birth to 3 or young children. So welcome. And today we're going to be talking about actually all of our disciplines in pediatric therapy. So physical therapy, occupational therapy, and speech-language pathology, and what we do and what we can do for you and how we can support you and your children or child. So Amber, who would you like to go first?
Rachel, why don't you just go ahead and go first? You did a great job starting us off, and you helped figure out how to get us set up here. So you can do the honors and go ahead and go first.
Okay. Sounds good. So I'm a speech-language pathologist, and so that everybody understands what that means, it's interesting. The profession is an older profession, and so in the beginning it was just speech, right? That my profession looked at. Later they looked at language, and since then they've also added dysphagia or swallowing, as well as other, or I should say all other communication aspects. So what does that look like? So what do SLPs or speech-language pathologists work on? They work on prevention, which means basically offering education as to why something is important, and also the consequences, right, that might happen from a skill not developing at a certain time. I love prevention. There's a quote, I think, like an ounce of prevention is worth a pound of cure, you know, so the sooner that you can get it done, the better. I absolutely, especially I think in 0 to 3 and working with young children, I think it's an essential component. So the other thing that SLPs do is assessment. So we use both standardized testing as well as informal observations, as well as reports from other people, like such as family members and other professionals, to gather as much information as possible before we arrive at a conclusion. I think it's a really important thing as well. Standardized tests have their place and they're wonderful, but in today's landscape, there's so many things that are changing, and our standardized tests are from so long ago that it really you need a team effort in order to make a really well informed clinical opinion on somebody.
Yeah, well said. Very well said. And I totally agree. I think that for me as a PT, especially as a younger PT, you know, I came out of school and it was drilled into me in school that like standardized tests are king. You have to have data to compare to normative data to say whether or not there's actually a problem going on. And that was something that I really, really struggled with as a new PT working in pediatrics, because I knew that there were standardized tests out there to measure gross motor capacity and ability. But my mentor at my very first job, she was wonderful. She still is wonderful. I'm in communication with her right now for a patient, actually. And it's really great to always learn from her. So thanks, Ellen. Shout out to you. But she really taught me, like, you need to move away from these standardized, like this really rigid standardized test mindset, and look at like what's actually functionally happening with this kid in the family unit, in their home, in their environment, and like how we can help them with the things that they're struggling with in those areas, as opposed to, oh, okay, like we're doing this test and you can't hop on 1 foot 5 times. So we need to work on hopping on 1 foot 5 times.
Yeah, absolutely, Amber. And in my case, I find that a lot of the standardized tests don't actually capture the deficit, so or the delay. So, you know, on paper, hey, the kid passes and everything's going great, but in reality, actually, there's a couple things that uh, you know, kind of those grayer or more nuanced areas. And I think in communication and in feeding, both of those are just so nuanced that a standardized test is a wonderful tool to really get to the you know, meat and potatoes, shall we say, but having input from all the team members, including family, is a really important component so that the child doesn't quote unquote pass the standardized test and yet not be able to communicate their basic wants and needs or effectively, right? So that's another piece of it too. Another interesting thing for SLPs is that we were one of the first of the 3 disciplines to be able to diagnose. And specifically, we diagnose speech and language differences. So I had a professor in college, I remember Dr. Rosenbeck, and he was such a legend at the hospital, at our local teaching hospital. The doctors would actually call him personally and say, hey, you know, this patient is a little bit too weak or deconditioned. You know, the thought of getting them an MRI might have not been the best choice for them to be managed at that moment. So they'd call in Dr. Rosenbeck and he would go, and just by listening to their voice or language, he was able to assess what type of stroke they had and where and all that cool stuff. So it's pretty cool.
Yeah.
And with that, though, to say we could arrive at that diagnosis, but we are unable to give the diagnosis without a physician to say, hey, yeah, we agree with you and we support your findings.
Yeah.
And then, of course, speech, right? So that's verbal communication, how sounds are produced, and language, how communication is combined to form meaning. So, language is fascinating, right? Because we think about it just as verbal, but it's sign. So American Sign Language, it can be augmentative and alternative communication, and many more things. You know, it could be also all of the combinations of it. So that's the other thing. You know, we've got to be really flexible in our, not only in our thinking, but in what we accept as communication, because it's all valid. All communication is valid. Another aspect that we look at too is social communication. So how children's communication skills are impacting their social skills. So here's an interesting thing. If we think about nonverbal communication, it's everything. It's eye contact. It's, you know, eye contact is typically how we tell if somebody's really, you know, how we as neurotypical people will say, oh yeah, that person's paying attention to me or not, right? Oh, the person's looking to the side because they're not listening. That will affect communication. So other person's body language. Areas that this encompasses is emotional intelligence, gestures, body language, facial expressions, conversational skills, and understanding figures of speech, so ambiguous language. Even also how one extends the topic of conversation and moves fluidly from topic to topic. You know, is somebody getting really honed in on just one thing and only able to talk about that one thing passionately, and then the subject gets changed and they totally are disinterested. You know, all of those things are social communication. And then there's cognitive communication. I mean, is your mind getting blown with all the things that speech pathologists are able to do? I mean, it's just like,
yeah, I mean, I think all 3 disciplines, they just go so deep, you know, and I'm really excited to share this conversation with the masses, because I know that whenever I have like friends or family, or even just strangers, and they ask, oh, what do you do? I say, well, I'm a pediatric PT. Their minds just go straight towards, you know, like, okay, cool, you play with kids. And there's so much more. So it's fascinating to learn like way more about speech therapy, because that's the discipline that I am least familiar with because I have the least amount of crossover.
Right.
So it's all such good
Yeah.
stuff.
Yeah, thank you, Amber. And that's so true. That's so true that, yeah, we are kind of we are the opposite ends of the spectrum, if you will, as far as how everything kind of works. But so another area that SLPs work on is cognitive communication. And so that's how we process information in our brains and how we use those areas to communicate effectively. So if we think about it, attention. You need to have a span of attention in order to remain on topic and to understand what's even being said. If your attention's too fleeting, you're not going to be really either able to communicate with an impactful way or really be able to understand that message either. So that also comes down to memory, mental organization. I'm sure we all know of folks that kind of, what's the term? Like in the movie Up, Doug the dog, squirrel, just whoop, something shiny and bright, and you're totally off topic. Problem solving skills, another really important thing, and executive functioning and more. And then the other thing so those are all just communication based. And then speech also goes off into swallowing because it's still the same mechanisms, right, that we use. And so swallowing disorders in children. So the oral preparation stage, how the lips move, how they come together, the cheeks, all of that, the tongue, oral transit, how that tongue propels the bolus or the ball of food, if you will, or liquid back into the mouth, and how well it stays together and cohesive, or does it kind of branch out and become a little bit more dangerous to manage. Pharyngeal or esophageal mechanisms that also may impact swallow safety. So I think it's pretty fascinating. It's the one area of, I think, my profession, Amber, that kind of mirrors yours in that it's a mechanical piece, right? I mean, there is some neurological component, but there is also in PT, it's muscle functioning. It's not really brain-based, if you will, gray matter based, it's more primal based. And then so feeding. Feeding is a complex area of development, and it really does require a skilled support team. And SLP is one component, and some teams, they're the only components, but typically other essential members are absolutely the child and the caregivers and parents. And other recommended allied professionals may include an occupational therapist, a physical therapist, a behavioral specialist, a registered dietitian, psychologists, and more. Just feeding is so complex in how many areas are affected, and if one area is broken or broken down or needs attunement, how those all kind of work together to a whole. Now, I did also want to talk about the signs to look for a language disorder. And this was taken from ASHA, which is the American Speech Language Hearing Association. That's my parent nationwide group.
Yeah.
And anyways,
we call them, I don't know, we call them governing bodies. So the American Physical Therapy Association is like our governing body. I don't know if that's how you guys.
No, that's beautiful. I just
that.
couldn't come up. I couldn't come up with the language. So thank you.
You're welcome.
So one of the hallmarks is not smiling or interacting with others. Again, this is in children. Not babbling from ages 4 to 10 months. Making only a few sounds or gestures like pointing, 7 to 12 months. Not understanding what others may say. So 7 months to 2 years. Saying only a few words, 12 to 18 months. Not easily understanding their words, so that's 18 months to 2 years. Not putting sentences together, that's about 1.5 years to about 3 years old. Struggling to play and talk with other children, that's about 2 to 3 years old. And having trouble with early reading and writing skills. And that's from ages about 2.5 to 3. And if you're kind of going, well, what the heck is early reading and writing? They're toddlers, and what does that look like? And so that could be making sounds or saying words when looking at picture books. That's from about ages 1 to 2. Pointing or touching pictures in the book when you name them. So that's a receptive language skill. And that's about, again, 1 to 2 years old. Turning pages in a book, 1 to 2 years old. Knowing that books have a front and a back. So being able to kind of write the book and get it to the right side, that's about 2 years to 3 years old. Enjoying that books have rhymes, so maybe giggling and smiling and laughing at the funny rhymes, that's about 2 to 3 years old. And pointing and naming to many pictures in books, that's about 2 years to 3 years of age. Amber, do you have any questions about any of those?
I really don't think so. I don't have any questions off the top of my head. You did a great job being clear and thorough.
Okay, thank you.
Yeah.
Would you like me to talk about the signs of a speech disorder or a speech delay?
Sure.
Okay. And again, this is according to ASHA. Your child may need one-on-one speech therapy because of a speech disorder, including saying these sounds incorrectly. This is about from 1 to 2 years old, saying the p, b, m, and h, and w. So p, b, m, h, w incorrectly in words, 1 to 2 years old. Saying these sounds incorrectly from about 2 to 3 years old, the K, G, F, T, D, and N. And then producing speech that's unclear even to familiar people. That's about 2 to 3 years old. And just a thing to keep in mind, your child may need speech therapy if they're having a hard time learning to talk. They're having difficulties pronouncing some or all sounds. However, please keep in mind, children ages 19 to 24 months, they're only expected to be understood about 25 to 50% of the time. Children ages 24 to 36, so 2 to 3, only about 50 to 75% of the time. So we're not looking for really clear, precise, articulate language sounds at this time, speech sounds.
Yeah. That's what, then that's that's the age of my daughter right now. She's 19 months now, and I understand her very well, but I feel like most of the time I'm trying to translate a minion to the rest of the world.
No. And that's so, I mean, yeah, as long as the words that she's saying are, so here's how I constitute a word. If it's the same word form used for the same object. So for example, wawa. Well, if that always means water, doesn't mean apple, doesn't mean crocodile, it only, wawa only means water, it's a word.
Yeah.
Now we're going to continue to shape it, right? When she says water, you're going to say water back and whatnot, or wawa, you're going to reply with water. We're going to continue to shape it, but she's absolutely making herself and her needs known. So that's great.
Oh yeah. 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 And like a real life example for that, for those of you who don't follow me personally, we just got back from a trip from Scotland and there are sheep everywhere. And the SH sound, and correct me if I'm wrong, Rachel, but the SH sound, the sh is kind of a complicated sound. They don't get that until they're older. I only know that because I Googled it because I was concerned.
Why didn't you ask me? I would have been happy.
It was, I know.
You misunderstood.
I should have. I really should have. But so the whole trip, there's sheep everywhere, and she can see out the window in her car seat from the van, and every time we see a sheep we hear in the background peepees, peepees. Because we say look at the sheepies. Or the sheep, she'll say peep.
So sweet.
It's so funny. But that's like a good real life example of like, we know that she means sheep. She only uses that sound and that specific word for sheep. It's just not the correct way of saying sheep because she doesn't have that SH sound yet.
So cute. Oh my gosh. But yeah, like all the cuteness that happens in the middle of that is so adorable.
Oh, I know.
A couple other things to look for. So if you're like, okay, well, what else? Is that all? Might my child, need one-on-one speech help? They're frustrated because they can't say what they want to. That's a big one. I have a thought, and this is my own personal, and that just is, as adults, we can recognize when somebody has an issue with something, but if they're not recognizing it yet, and there's still time for it to develop, I don't want to be the one to bring that up, Like, so for example, Amber, in your case, if she's saying peepees and you're saying sheep, you can, you know, if you're doing it in a fun way. But if you say, no, that's not how you say it sheep, that
Right.
could,
Yeah. She would be getting scolded
well,
instead of
right.
encouraged.
And that exactly. And for her, then she might go, oh, well, I can't say it at all, so I'm just not going to say anything. And then so
Mm.
all that beautiful time where you guys were probably laughing on the floor when she's saying all these cute things and her cute little voice, who's getting even more excited, right? Because she's saying something that's so cute, and then you guys are laughing, which makes her want to do it and participate even more. So that's like
Mm-hmm.
that positive cycle of communication, right? She does something cute, you guys laugh at it, so she's like encouraged to do it again. If you were to either scold her or say no and bring it to her attention that she's not doing it or saying it in a way that you would like her to, that cycle could be broken, right? So instead of her wanting to say it, she's going to feel, oh, I'm going to get told no, or I'm going to get told that I did it wrong, and so I don't want to do it anymore. And so that beautiful thing that you guys built with, I hope, a lot of videos and memories and pictures on it would have been broken. So
Mm-hmm.
just something to consider. Um, the other one is that, well, okay, fluency is another one to talk about too. So again, fluency can be an absolutely typical stage in development. And I'm on the same page with fluency that I am, as I just mentioned to you on this. If a child's aware of it and becoming discouraged, becoming self-conscious, becoming aware in a shameful way, like, oh, I don't want to say it because I'm not going to say it in a way that sounds like others, yeah, we absolutely want to look at it and start to work on some strategies. If a child is blissfully unaware and just stuttering, I'm of the mind, and this is just my own personal opinion, to just let it go until it becomes a problem. And so there's secondary behaviors that, again, this is something that would probably be suited for a different conversation, but there's, just look for secondary behaviors. You could ask another SLP. But the secondary behaviors are another thing that show that the child is possibly aware of what's happening and just maybe not verbalizing it. And then the other one is just that if there's any sort of trouble during feeding, you know,
Mm.
seek some help, ask your care team or your pediatrician, and just be very clear, hey, this is what's going on, and get some answers that make you feel fulfilled and feeling like you got heard.
Yeah. Good advice. Good stuff. Thanks, Rachel.
Yeah.
Do you have anything else? Is there anything else you want to add?
That's it. I think that's it. That'll put a period
Okay.
at the end of that sentence.
Cool. All right. Sounds good. So I'll take the baton. I don't know, pass the baton,
Here it
whatever. I'll
comes.
start talking about physical
Okay.
therapy. Yeah. So 9 times out of 10, or maybe even more than that, when you hear that somebody is a physical therapist, you're going to think like, okay, so it's who you go to after you have your knee replaced, after you have a shoulder rotator cuff repair, after you have a sports injury, or you've had some sort of big surgery, or you have some sort of pain. That's kind of what you're thinking about whenever somebody says, oh, I'm a physical therapist. And those are the generalists or the orthopedics or the outpatient physical therapist. I worked in that setting for about a year while I was easing my way into pediatrics, and it's a cool setting. It's by far something that I would rather do than like any other type of job, but it's not pediatrics. I love pediatrics. It's just so fun, and I know that it's not for everyone, so I'm glad that I feel this way about pediatrics, because I don't feel this way about like geriatrics or orthopedics. And I have friends who do feel that way about those settings of physical therapy, and that's awesome. So kudos to them. But we're going to talk about pediatric physical therapy today. So me as a pediatric PT, I don't just play with kids. And I'm not your kiddo's gym teacher. I'm not your kiddo's like daycare, drop them off for 45 minutes. They get to run around and play, and then they leave. So really, whenever somebody is referred or a kiddo is referred to pediatric physical therapy, there can be a lot of things going on. We can treat a number of different things, and we see kids that have all sorts of diagnoses and syndromes, or we can see kids who are typically developing and maybe just fall a little far behind and have some sort of gross motor delay, but they're cognitively typically developing. There's such a wide range, and I specifically overlap a lot with occupational therapists, and it's really fun because then we kind of get to work together. I've seen kiddos specifically just for physical therapy who have not had any other services, but most of the kids that I've seen in my experience also get some sort of other type of therapy, whether it's OT or speech therapy. But usually if they're getting PT, a lot of times they will get OT as well. So I'll talk about what I do, and then Rachel, if you want to kind of jump in with what you know. We did a little bit of research, and we've of course worked with many different wonderful OTs over the years. So we really hope that we do OT as a career, and as a discipline justice. If you're an OT and you're watching this and you want to add to the conversation, go ahead and use that comment section, because we are going to post this to our page live after the live is over. So it's going to live there, and we would love to continue the conversation. So as a PT, I'm going to address things like body function, range of motion of joints, the musculoskeletal system, which is like all of your muscles in your body and all of your bones in your body. So that's going to be things like muscle strength, muscle endurance, muscle power. And I'm going to look at those things. If there are deficits in any of those areas, I can make a plan, and then we can kind of work on exercises and activities and different types of play to be able to improve upon those things. I can also work with people who are kiddos who struggle with things like balance, coordination, proprioception, which is knowing where your body is in space. And there's such a wide variety of things, right? So I can see kiddos who only have musculoskeletal problems. I can see kiddos who have like a disconnect between their nervous system and their muscles, or maybe there's a disconnect between like their brains and the rest of their nervous system and their muscles. Or maybe there's just like, maybe they're a little bit on the weaker side, they're a little lower tone, and we need to work on proper strengthening. And then there's the part of physical therapy that I really love the most is equipment and bracing. And that's really specific. Not everyone, not every kiddo that comes in to see me as a pediatric PT or to see any pediatric PT is going to need equipment or bracing. But that's really what I love, because it's like, it really gets my nerd brain flowing, and it challenges me, right? Like I have to think about, okay, what's this kiddo look like functionally without the equipment? And then once I apply the equipment, how can we adjust it so that we can get kiddo looking the way that they should look when they're doing this motion, so that they get stronger, so that they don't need the equipment in the future, if that's the case for that specific kiddo. So that's kind of what pediatric physical therapy looks like in a nutshell. I could go on and on and on, because it's going to look different for a 6-month-old versus a 3-year-old versus, a 7-year-old or a 12-year-old. It really just depends on what they've got going on, what they struggle with functionally, and what PT can do to help fix it. If the kiddo has a concern, or if parents have a concern and they say, hey, they're not crawling on hands and knees, they're butt scooting everywhere, then let's figure out why they're butt scooting and encourage them to crawl on hands and knees. And I will help you work through those and give you ideas on how to work on activities to get them through hands and knees crawling. Or if kiddo is really struggling with bilateral coordination, so moving 2 sides of the body, arms and legs at opposite times, you have to do that to run. So maybe we're struggling with running. I can give specific exercises for that kiddo to work on getting them to use their body opposite sides, opposite limbs at the same time.
And Amber, what are your thoughts about, so I'm thinking of the CDC and the milestones. So what are your thoughts about how the milestones, such as tummy time to crawling to walking, all of those things, what's your opinion? Is there any correlation? Do they build upon each other, or is it okay to skip? Or, I mean, what's that look
Yeah,
like later?
it's a basic question because you totally know the answer. But because we've talked about this so much. But for those of you who are watching who may not know, yeah, it's like I love to explain gross motor milestones specifically as a house. And you want to build a really firm foundation. And that firm foundation is going to come through mostly tummy time. Now, tummy time is not the end all be all. It's not like the holy grail, the only play position that your baby should ever be in is tummy time. That's not what I'm saying. Your baby should play in all sorts of different positions. So tummy time, back, each side, sometimes supported sitting, sometimes for babies, especially if they're under 6 months of age. But tummy time is so foundationally important because they do build upon each other. So if you have really good tummy time, if you don't have anything going on that's going to mess with tummy time, then you're likely going to have a kiddo who has really good upper body strength and skeletal development. So it's going to help develop shoulders, elbows, hands. You're going to have a kiddo who has really awesome core strength because you're pushing through both hands up at the same time and getting a involuntary core muscle contraction. And those things are going to lead to independent sitting. You have to have really good head control, really good core strength to have independent sitting. And then, a kiddo innately just wants to move. I've never in my life, if I've ever met a lazy baby. Babies aren't lazy. Things just are hard sometimes. So babies aren't ever going to just sit still and be content in sitting. They're going to want to move. So if you've got a kiddo who has good head control and good trunk control, and they're able to kind of twist around and transition into side sitting, then you're going to have a kiddo who crawls. And crawling is just such an important milestone. And it's not on the CDC's list anymore. That's a soapbox I don't want to go into right now. But if you've got a good crawler who's hands and knees crawling, then you're getting a lot of good strengthening for your muscles and your joints and your skeleton, because that nice mature skeleton and that spine is starting to form so that you've got the proper amount of curve in the spine. So then you're going to have a kiddo who, because they're crawling and they're learning coordinated bilateral movements, upper body moving at the same time as lower body, but in opposite directions. So you're disassociating upper and lower body as well in all of that. Crawling is just so complex. Hopefully we're going to have more information and more education available to you guys through our website. Coming soon. I'm so excited about it. But if you've got a good crawler, then likely you're going to have a kiddo who wants to pull to stand. And then pulling to stand leads to walking, walking leads to running, running leads to jumping and climbing and doing all of the things that kids are supposed to do. So yes, everything, it does just kind of build upon each other. And if you've got a hiccup in there, or if you've got something that's hindering a kiddo, whether it's like one side's stronger than the other, or one side's weaker, one side's tighter, we as pediatric PTs, we can analyze their movement, look at their body, look at their range of motion testing, talk to you as parents or caregivers about their functioning, what's happening, what you're seeing, what you're concerned about, and then we can tailor individualized programs, activities, playtime to help work on those things so that kiddo can functionally crawl on hands and knees to get across your living room, crawl on hands and knees to climb up your stairs, safely come downstairs on their bellies, complete a good sit to stand from a chair that's appropriate for their size. So they're not just like extending backwards, but they're leaning and transitioning their weight forward over their feet so that they are bending forward at the hips and like actually standing well. So there's a lot that goes into pediatric physical therapy, and that what I've talked about here is just for like what we would consider a typically developing kiddo who doesn't necessarily have like a really complex diagnoses. I could talk for hours about different diagnoses and what we see and what we do for them and whatnot, but this is just, it's not the space and we don't have the time for that. So
Yeah. Thank you,
whew,
Amber. Yeah,
yeah, of
that was
course.
awesome. Definitely. And then like Amber had alluded to earlier, so Amber and I are kind of, out here, and the circle that combines both of us is the occupational therapy world. Occupational therapy looks at, like Amber was saying, gross motor and proprioception. Then they also help with feeding and sensory. Sensory is one of the biggest things, I think, in our EI world where we utilize OT for, just because it impacts so many children. We all have sensory needs. Some of us, if we think of it again on a spectrum, some of us, our sensory needs are kind of just more in the center. And so we can tolerate loud noises, obnoxious smells, itchy fabrics, and everything else. And then there's other people who are one of the, who kind of have less tolerance or who have more tolerance where, it doesn't even faze them. It's fascinating. I think sensory is really fascinating. But
Yeah,
a
it is.
couple,
Rachel,
yeah.
before you get too far, just to clarify, at the very beginning of that, you said that OTs will look at gross motor, and sometimes, depending on the training, because a lot of times the continuing education for OT and PT, they will overlap. So some OTs are really good at looking at gross motor and looking at motor planning of the whole head to toe body. But there are other OTs, and I would say that most of the time when you think of a physical therapist, they're going to think about the fine motor system. So it's going to be like the functioning of the fingers, the hands, the forearms, the elbows, the shoulders, and then sometimes the neck. So I just wanted to make sure that I clarified for that. Now, that being said, there are tons of trainings, and I'm not an OT. I didn't go to OT school, so I don't know what OTs come right out of school knowing. But in my experience, the OTs that I've worked with have years and years and years of experience, and they have all of these awesome continuing education trainings. So they've learned and they've built upon that like foundation of what they know about the whole motor system, and then they've learned way more about the gross motor system and about like full body motor planning and whatnot. Like I know that our NDT therapists are wonderful with looking at head to toe full body.
Yeah, and Amber, that too, I mean, for feeding, right? So feeding is a fine motor skill. I don't
Mm-hmm.
believe that OTs learn dysphagia or feeding per se, as far as, the lips, the tongue, and whatnot in their own schooling. But yeah, sure, they could take continuing education courses and
Yeah.
so learn similar
Which, right,
things.
too, and apparently that's something too that we're finding through like the Instagram world, that we're seeing some physical therapists are even kind of starting to take further education and whatnot, and like to get into like the motor side of the feeding world. I think it really, at this point, we don't want things to blend together so much so that we can't identify each individual discipline, right? But I think that it's interesting that you can have like a PT who's really interested in feeding, or like a speech therapist who's really interested in motor. Because I've seen speech therapists too, who will kind of like go into like the structure and function of the neck and how the spine and like the curvature of the individual neck, of the individual cervical spine can like affect swallowing and feeding. That was actually something that's new. I hadn't talked to you about that yet, so I'm excited to bring that up
Yeah,
later.
no, very true. And just to say that I still feel, because I have, well, it's probably not the right avenue to talk about this, but just to say that just because you take a couple continuing ed courses, you still should defer to the person who had semesters
Yeah.
on the topic,
Oh yeah.
because
Yeah.
especially with swallowing, it's kind of dangerous. So just to say, consult. But back to OT.
Yeah.
So the fine motor is one area that they do, which controls the movement of our hands and muscles. Visual motor skills, which is a really important piece of of learning too. So helping to coordinate what we see with our eyes, you know, how our hands work together with our eyes. So if you think about like Tom Brady, for example, like if he didn't have good visual skills, the guy wouldn't be where he's at or
He
where he
did
was at.
have a good team surrounding him.
He
Let's not talk
he
about
still had to throw it to somebody though.
let's not talk about football.
Okay. So executive functioning skills. So here's another area where OT and speech can overlap. So helping us plan, initiate, organize, remember, and connect information. That's another thing that a speech pathologist can do. You know, here's the thing about it as well. I think we have so many, our umbrellas are so big for every profession. And then I think that within that, because they're so big, we all just kind of are we follow our interests. So if it's not an area where we're either strong because we don't have those skills that are strong, or we're just not interested in that, we'll allow that for somebody else to take interest. So because we all have the same quote unquote education does not mean we all have the same interests and experience within the field. So that's another really important
Right.
piece. So back to sensory, for example, I have worked with occupational therapists that don't know sensory at all. And so, or maybe know it peripherally, but haven't had much experience with it. And so for the kids that, a lot of the children that we work with, Amber, they need somebody with that more experiential knowledge because they're really complex kids. And so
Yeah.
just because that's your designation does not mean that's your expertise. That's fine. Not everybody has to like everything in every piece of it. Self-care skills is another one though that I definitely always would think about in, you know, for the older population. But even for the younger ones, right? So that fine motor piece, how to get dressed, how to feed, how to toilet and brush hair, you know, how to button buttons or zippers, zip up zippers.
Tie shoes.
Yeah. Academic skills. So again, they can be overlapping speech with reading, and they would though be the writers, right? So the fine motor for writing, and again, overlapping organization skills with speech. Play skills, social participation. So again, overlapping with speech, and then the sensory processing. Now, I think what's an interesting piece is that there's just not enough of us therapists to really help serve all of the population that needs it. And so especially we see this with the early intervention teams, you know, we all wear multiple hats. You know, we're taking off the motor hat, putting on the fine motor hat, taking off the fine motor hat, putting on the feeding hat or the communication hat. And so that's where that, I think, cross training is really important. However, if it again becomes so apparent that the skill or the need is there that's greater than your information or education, that's when you really need to knock on the door of the person who is the better fit for that. And not even necessarily to treat, but just to get more information so that you can help serve that child better.
Yeah, I totally agree. And that even too, that varies from state to state. Whenever you want to talk about specifically early intervention, there are some states that only allow one provider. And so usually what happens is the program will decide which provider goes in. And so maybe it's a speech therapist, and the speech therapist will do all of the evaluations globally for the whole kiddo. And then they'll see like, okay, here's where the needs are. And if the kiddo needs gross motor, but there's not a PT available, then a lot of times you'll see an OT or even a speech therapist take that over. I know that the last position that I interviewed for, I met the whole team, and there were tons of speech therapists, and they all said like, we have some experience, even though we're not comfortable because we're not PTs, but like we do help with gross motor development because we either don't have a PT on the team, or like there's not a PT available in the area, or for whatever circumstance. So yeah, I love working interdisciplinary in these ways, because like me as a PT, because of working with you and other speech therapists that I've interacted with and worked with in the past, like I know what to look for with kiddos, so I can put speech into a PT session by narrating what the kid's doing, being really, really emotional and really energetic and really excited about things that are happening. And adding action words. So like if we're doing sit to stands, we can say stand up, sit down. And like I know that those are really good communication things to build in because I've worked with really good speech therapists in the past. So, and I love, another thing that I love to do is when I'm working with a kiddo who has speech therapy, I like to either go in and look at the notes and see the goals, or like actually have a conversation with the speech therapist and say, hey, what are your goals? How can I encourage the goals during PT?
Yeah, well, and I mean, that's beautiful, Amber. And physical movement helps communication. So especially because physical movement tends to be so exciting, right? Up and down, you know, kids that want to move, they associate those words with fun because it's fun.
Yeah.
So jump, 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 or splash, or whatever, you know, all these action words. So yeah. So getting back to OT though, how would a parent know that their child may need OT support? Fine motor and tabletop activities. So having issues with, you know, holding a crayon or a pencil or a pen, drawing, writing, using scissors, having developmentally appropriate play skills. Now, again, that could be speech too, because that's looking at that cognitive aspect of play. Behavior, self-regulation, coping skills. So that self-regulation is truly the foundation of the behaviors and the coping skills. If we're not regulated, let's say we're stressed out, we're overtired, we're hungry, all, you know, it's kind of like for even functioning adults, put any of those stressors on any of us and we're kind of, you know, a house of cards and we might not be able to keep it together. Imagine not having a developed brain and having all those stresses on top. It's like,
Yeah.
oh, I totally understand throwing yourself on the floor and kicking your heels into into the floor because it's frustrating.
Right.
And with that comes along transitions and flexibility. So, you know, it's that cognitive aspect, but really underlying it, it's that regulation of sensation. Visual attention, spatial awareness, and then it goes into, you know, tactile, which is again sensory, motor planning a little bit, executive functioning, and even food, so feeding skills. Now, I
Yeah.
just wanted to take a second too, Amber, and talk about like what we're doing here at NewDay. So we have, you know, we have our own separate professions, but we are integrating our knowledge and interweaving our knowledge so that parents that are join our community, participate in our talks, get the best of all of us. So we're going to synthesize the information. So like you were just giving the example, Amber, of how you're working on gross motor skills, but you're combining, you're putting a piece of communication in there. Well, we can go even one step further with the occupational therapist and add a sensory element in there, you know? So it's just, I think it's the best way of helping families help their children the most fluidly and most efficiently and effectively.
Yeah, definitely. Right. And then you're not having to juggle like multiple different memberships and multiple different types of courses, right? Because there are PTs who are out there who are kind of doing the same thing. There are speech therapists out there who are doing their own courses and their own work. And there's OTs out there who are doing their own courses and offering their own advice. But here with us at NewDay, we are taking all of that information, we're combining it, and we're putting it in one place so that parents and caregivers who join the community don't have to juggle and find like, okay, I want to know about all of these things. I want to know about global whole development. They don't have to find 3 different places on the internet or within the community or wherever they're looking. They don't have to find 3 different places and log in to 3 different memberships, and have 3 different payments on their credit card, to learn all of the information. We are pulling it all together so that it's available in one place, making it more efficient for you. And we hope that you have fun with us because we have fun together, and we want to have fun helping you.
Totally. And just that one piece that you mentioned. So if you have 3 different disparate places, you know, Amber or the physical therapist could be talking about up and down, or showing your child how to get up and down from a chair. And so that's what you're focused on for that, you know, aspect of gross motor. And then let's say you log on to the SLP and the speech pathologist is talking about off and on, or another opposite concept. And now you're focused on the light, you know, off and on with the light, you know, and then sensory wise, you know, the occupational therapist is there and they give you another piece of advice. You're going to be focused. I mean, how many hours a day is that to do all 3 of those, rather than integrating and interweaving all the information together in a cohesive way so that it's the biggest bang for your buck, if you will, as far as your time, which is, as we know, the most important thing. Time is a diminishing resource that you can never get back once it's gone. So the other thing to say is that today we went live. Our website is live. And so this is part of our gift to you today, is this first Facebook Live. We're offering another live for this month in July. Our next live is at 12 noon PST, Pacific Standard Time, on Facebook again on July 15th, which is another Monday, 2 weeks from today. And hopefully our intention is to move this conversation to our private, judgment-free community social space, where we are a heart-centered community looking to help blossom and to help just to help grow all of that beauty. So
we want to help you as parents and caregivers facilitate your child's development, right? Because you as parents and caregivers, you are the expert on your kiddo. We just want to come alongside you and give you the tools so that you know how to help them grow.
And Josh shared that we did a great job and it's been very informative. So Josh, thank you so much for your comment. And thank you for listening to us and for sticking around and having to hear what we have to say. And yeah, for those of you that have any questions for us, please just drop us a note below. We also are on YouTube. We have a really fun Ask the Expert video where we talk to Dr. Angela about pelvic floor. And then we're also on Facebook, as you know, and Instagram. So follow.
Yeah, we can't wait to interact with you on all of our different platforms. Go check out our website. It's www.newdaychildcoaching.com. Today is the first day that it's live and it's beautiful. Rachel did a great job. I had no part in designing this website. It was all Rachel. So she did a wonderful job. Go look at it because it's beautiful. Yeah, and just, you know, consider joining our community. We would be so happy to have you. If you've got questions, you can reach out to us at any of our socials. We'll be more than happy to support you along the way.
And Mom, my mother's here. Thank you for that comment. Mom said, very well put, ladies. Great job. Thank you, Mommy. Love you. All right, everybody. Everyone. Thank you so much for sticking with us. We'll see you next time.
Sounds good. Rachel, are we going to do our sign off?
Let's do it.
Okay.
From those of us here at NewDay, have a good day. Bye, everybody.
Thanks so much for sticking around for that conversation. We hope that you learned something. If you have questions, clarifications, or comments, go ahead and add those to our comment section below. And we hope that you gave us a subscribe. We can't wait to grow this community and to walk with you and learn with you. So we hope that you have a great day and we will see you next time. Thanks for joining us at NewDay Child Coaching.